There's a version of you right now that might be aging on the inside faster than you are on the outside. Not because of anything you did wrong, not because of some dramatic event you'd remember, but because the organ working hardest inside your chest, roughly 100,000 times a day, has a way of wearing down quietly without asking permission, without raising an alarm until the damage is already substantial. And the strange part is, most people who are living through this process have no idea it's happening to them. I want you to sit with a question for a second. If your heart had been quietly aging faster than the rest of you for the last several years, would you actually know? Not guess, not assume. No, because here's what 2 decades of sitting across from patients has taught me. The heart rarely announces trouble the way movies and television have trained us to expect. There's no dramatic clutch of the chest, no collapse in a doorway. Instead, there are small, almost forgettable moments. A flight of stairs that suddenly feels steeper than it used to. A ring that fits a little tighter by evening. A night that gets interrupted for reasons you've never thought to question. These moments get explained away so easily. Getting older, not sleeping well, overdoing it at dinner. And that explanation feels so reasonable that almost nobody stops to ask if something else might be going on underneath. This is the story of what your heart is actually trying to tell you, translated out of the quiet language it speaks and into something you can actually act on. Because here's the thing worth understanding before we go any further. The people who catch these signals early don't just live longer. They live differently. They keep hiking. They keep chasing grandkids across a backyard. They keep the kind of independence that so many people assume simply disappears with age. And the people who don't catch these signals, by the time it becomes undeniable, the conversation has usually shifted from prevention to damage control. So let's talk about what's actually happening inside your chest as the decades accumulate, because understanding the mechanism changes how seriously you take the warning signs. Your heart is not a static object. It's a living, working muscle, and like every muscle you have, it responds to time to use and to how well you treat it. Somewhere around the 6th decade of life, the walls of the heart begin a subtle thickening. The major arteries lose some of their natural elasticity, becoming stiffer, less able to expand and contract with the rhythm of each beat. The heart's internal electrical wiring, the system responsible for keeping every beat perfectly timed, becomes slightly less precise. And the valves, the small mechanical doors that keep blood flowing in one direction instead of sloshing backward, begin to show the wear you'd expect from something that's opened and closed more than 2 billion times over a lifetime. None of that on its own is a crisis. It's simply what happens to a muscle that has been working nonstop since before you could form a memory. The real question isn't whether your heart will change with age. It will for everyone without exception. The real question is whether it ages on a normal, graceful timeline, or whether it's being pushed into something faster and more dangerous by forces that are almost entirely invisible. There are 5 of these accelerating forces, and what makes them so dangerous is precisely that none of them hurt. Chronic low-grade inflammation moving quietly through your blood vessels, a body that has slowly become more sedentary than it realizes, blood sugar that runs a little high year after year without ever crossing into a diagnosis, blood pressure elevated just enough to strain the system, but not enough to cause an obvious symptom. And stress, not the dramatic kind, but the low, constant hum of daily pressure that never fully switches off. Any one of these, left unaddressed for long enough, can age a heart by 10, 15, even 20 years beyond what the calendar says. And because none of them announce themselves with pain, most people never think to connect the dots until something forces the issue. There's an important psychological reason this happens, and it's worth naming directly. Human beings are remarkably good at adjusting to slow change. If your ability to climb a hill or carry groceries declines suddenly overnight, you would notice immediately and act on it. But biological decline almost never works that way. It arrives in increments so small that your own sense of normal quietly shifts along with it. You don't notice the hill getting harder. You notice yourself avoiding the hill, and you explain that avoidance as preference rather than necessity. We adapt to gradual decline so smoothly that we lose the ability to recognize it as decline at all. This is exactly why the warning signs matter so much. They are, in a very real sense, your heart's only method of communication before things become serious. Learn to read them, and you gain something incredibly rare in medicine: the ability to act before a crisis instead of reacting after one. Let's start with the one almost everyone experiences and almost nobody reports to their doctor. It's breathlessness, but not the kind you'd expect. It's not gasping after sprinting or hiking a mountain. It's subtler than that. It's noticing that a set of stairs you've climbed 1,000 times suddenly asks something more of you than it used to. It's reaching the top of your own driveway and feeling your chest work a little harder than it should for something so ordinary. The change is rarely sudden. It creeps in slowly enough that your brain simply recalibrates what normal feels like, month after month, until you've quietly redefined your own baseline without noticing. Here's what's actually happening beneath that feeling. As the heart's lower left chamber, the one responsible for pumping oxygen-rich blood out to the rest of your body, becomes stiffer with age or with untreated risk factors, it loses some of its ability to relax and fill properly between beats. Doctors call this diastolic dysfunction, and it's remarkably common, quietly present in a significant percentage of adults well before any official diagnosis is made. When the heart can't fill efficiently, it can't push out enough blood with each beat to fully meet your body's demand. Your muscles, your brain, your organs, they all sense that shortfall. And your body's automatic response is to breathe faster and work harder to compensate, which is the very sensation you're interpreting as simply being out of shape or getting older. Research following older adults has found something worth taking seriously here. Even when a basic heart test looks essentially normal, the presence of this kind of diastolic stiffness meaningfully raises the risk of future heart failure. In other words, the earliest whisper of trouble can exist well before any conventional test would flag a problem, which is exactly why paying attention to how your body actually feels during ordinary activity matters as much as any single medical test. The second signal hides in plain sight, quite literally at the bottom of your legs. It's the kind of thing people notice and then almost immediately dismiss. Ankles that look a little more swollen by evening than they did that morning. Skin that, if you press a finger into it, leaves a small indentation that takes a few seconds too long to spring back. Shoes that fit perfectly at breakfast and feel snug by dinner. Most people attribute this to standing too much, sitting too long on a flight, or simply the mysterious unfairness of getting older. But there's a physiological story unfolding here that deserves more attention than it usually gets. Your circulatory system depends on a two-way relationship. The heart pumps blood outward and your veins are responsible for carrying it back. When the heart, particularly its right side, becomes weaker or stiffer than it should be, it struggles to keep pace with that returning blood flow. Pressure builds up in the venous system. Fluid gets pushed out of the blood vessels and settles into the surrounding tissue. And thanks to gravity, it pools exactly where you'd expect. Your ankles, your feet, your lower legs. This pattern, worse by evening, improved by morning after your legs have spent the night elevated, is a recognizable signature of fluid backing up somewhere in the system, and the heart is one of the first places worth investigating. To be fair, swelling in the legs has more than one possible cause. Certain blood pressure medications can trigger it, so can kidney issues, vein problems, or simply too many hours in one position. But the pattern is the clue. Swelling that builds through the day and eases overnight, that's the signature worth mentioning to a doctor by name, because early fluid retention linked to the heart is remarkably treatable when it's caught before it progresses. The third signal is the one that surprises almost everyone I've ever explained it to, because it happens somewhere you'd never think to look for a cardiac clue. In the middle of the night in your own bed. It's waking up to use the bathroom more often than you used to. It's needing an extra pillow just to breathe comfortably while lying flat. It's occasionally jolting awake feeling like you can't quite catch your breath, needing to sit upright or move toward an open window before things settle. Most people assume nighttime bathroom trips are simply a bladder issue or in men a prostate issue, and sometimes that's exactly what they are. But there's a second explanation that almost nobody considers. During the day, gravity pulls fluid downward into your legs. The moment you lie down at night, that fluid redistributes back into your bloodstream, and your heart has to process that returning volume. If your heart isn't handling blood flow as efficiently as it should, your kidneys step in as backup, filtering out that extra fluid, which is precisely why you find yourself awake at 2 in the morning for what seems like no obvious reason. The breathing piece of this puzzle is even more telling. When fluid that has accumulated in your legs during the day shifts toward your lungs at night, and a weakened heart can't clear it efficiently, the result is a genuinely frightening sensation of breathlessness that pulls you out of sleep. This has specific names in cardiology, and it's taken seriously precisely because it's one of the clearer signs that the heart is struggling to keep pace with the body's basic demands. It gets blamed on stress, on caffeine, on aging sleep patterns, almost anything except the actual source, while the heart itself goes unexamined. A written sleep log kept for even a single week, tracking bathroom trips, pillow count, and any breathless waking, can reveal a pattern far more clearly than memory alone. The fourth signal might be the most dangerous one precisely because it feels so unremarkable. It's fatigue, not the kind that follows a long day or a poor night's sleep, but a deeper, more persistent exhaustion that doesn't lift no matter how much rest you get. You wake up after a full 8 hours and still feel like you never slept. You sit through a quiet morning doing essentially nothing and find yourself completely drained by lunchtime. This kind of tiredness has a texture to it that's different from ordinary fatigue, and learning to notice that difference can matter enormously. The mechanism here comes down to oxygen delivery. When the heart isn't circulating blood efficiently, Every tissue that depends on that oxygen, your muscles, your brain, your organs, receives less than it needs, and everything downstream simply runs slower. You experience that shortfall as a bone-deep tiredness that no amount of sleep seems to touch. This particular warning sign carries extra weight for women. Research has repeatedly shown that women are considerably more likely to experience heart trouble through atypical symptoms rather than the dramatic chest pain most people associate with cardiac events. Unexplained fatigue, sometimes lasting for weeks, frequently shows up as an early signal well before anything more obvious occurs, and it's routinely dismissed by patients and sometimes even by clinicians as simply the byproduct of a busy or stressful season of life. One widely cited study found that a striking majority of women who went on to experience heart attacks had reported unusual fatigue in the weeks leading up to the event, and most never connected it to their heart at all until it was explained to them afterward. Older adults are so routinely told to expect fatigue as a natural feature of aging that genuine warning signs get absorbed into that expectation almost automatically. And it's exactly that assumption that so often delays the evaluation that would have caught something treatable. The fifth and final signal is the one people notice most often and mention least often, usually out of a mix of embarrassment and uncertainty about whether it's even worth bringing up. It's a flutter in the chest, a sensation that your heart skipped a beat or briefly raced or pounded unexpectedly before settling back to normal. Some describe it as a flip. Others say it feels like something briefly out of rhythm inside their chest, there and then gone before they can even fully register it. Here's the nuance worth understanding. Occasional, brief flutters in an otherwise healthy person are usually harmless, minor electrical hiccups that become more common simply with age, sometimes triggered by caffeine, alcohol, dehydration, or stress. But there's a specific version of this sensation that deserves far more attention, and it's when the rhythm feels chaotic rather than simply skipped. Especially if it lasts more than a few seconds, comes with dizziness or breathlessness, or happens frequently enough to become a pattern rather than a rare occurrence. That specific, chaotic irregularity has a name: atrial fibrillation, and it is remarkably common in adults over 60, affecting millions of people, many of whom have no idea they're living with it. In this condition, the heart's upper chambers quiver rather than beat with their usual coordinated rhythm, and that disorganized activity creates the conditions for blood to pool and clot inside the heart. Those clots don't stay put. They can travel to the brain, and this single mechanism is responsible for a significant portion of strokes in older adults, increasing the risk by a substantial multiple compared to those without the condition. What makes this particularly urgent is that atrial fibrillation can be almost entirely silent, discovered only after a stroke has already occurred, or it can present exactly like those brief, forgettable flutters that everyone tends to wave off. A simple, practical way to check in on this yourself is to place 2 fingers on the inside of your wrist and simply notice the rhythm. Steady and even is reassuring. Erratic, uneven, or unpredictably fast is worth mentioning specifically by description at your next appointment. Understanding these 5 signals is powerful, but there's a second layer to this story that matters just as much: the everyday habits that quietly accelerate this entire process without most people ever realizing it. The first mistake is trusting how you feel as a reliable indicator of heart health. It isn't. Elevated blood pressure, often called the silent condition precisely because it produces no symptoms at all, affects a striking majority of older adults, and it does its damage invisibly, thickening and stiffening the heart muscle over years while the person carrying it feels completely fine. The only real defense against this is simply knowing your actual numbers rather than assuming everything is fine because nothing hurts. We're wired to trust symptoms as our primary feedback system, but when it comes to blood pressure, the absence of symptoms tells you almost nothing. The second mistake is retreating from movement out of fear or discomfort. Aching joints, cautious knees, and half-remembered stories about someone who had a heart attack while exercising all conspire to push people toward sitting more and moving less as they age. But inactivity itself is one of the single most powerful accelerators of heart aging that exists. Body that moves less develops higher blood pressure, higher blood sugar, more inflammation, and stiffer arteries almost as a direct consequence. The encouraging part is that the threshold for benefit is remarkably low. Something as simple as a brisk 20 to 30-minute walk most days of the week has been shown, across large population studies, to meaningfully reduce cardiovascular risk. The heart doesn't require intensity. It requires consistency. And for those whose joints make walking difficult, stationary cycling, water-based exercise, or resistance bands offer the same underlying benefit. The third mistake is ignoring disrupted sleep as an unrelated annoyance. Conditions like obstructive sleep apnea, where breathing repeatedly pauses throughout the night, are remarkably common and remarkably underdiagnosed in older adults, particularly those who snore heavily or wake up exhausted despite a full night in bed. Each pause in breathing triggers a temporary spike in blood pressure, and repeated night after night for years, this creates measurable strain on the cardiovascular system, contributing to hypertension and abnormal heart rhythms over time. Treating this condition has been shown to meaningfully improve heart function, which makes it one of the more overlooked opportunities in preventive heart health. The fourth mistake is underestimating what blood sugar does to the cardiovascular system long before any formal diabetes diagnosis exists. Even mildly elevated glucose, sitting quietly in what's often labeled a prediabetic range, contributes to inflammation and damage inside blood vessels over years, setting the stage for arterial plaque buildup well before symptoms appear. The cardiovascular risk associated with elevated blood sugar climbs dramatically once someone crosses into a full diabetes diagnosis, but the underlying damage typically begins accumulating years, sometimes over a decade, earlier. And the fifth mistake is treating chronic stress as simply an unavoidable feature of modern life rather than a genuine physiological threat. Sustained stress keeps the body's stress hormones elevated on a near constant basis, and those hormones raise blood pressure, raise blood sugar, promote inflammation, and stiffen arteries, while also fueling the very behaviors, poor sleep, emotional eating, reduced activity, that compound the damage further. Multiple long-term studies have identified chronic stress as an independent risk factor for heart attack and stroke, even after accounting for every other traditional risk factor. Managing it deliberately isn't a wellness indulgence. It's a measurable form of cardiac protection, and your body makes no distinction between stress you've simply accepted as normal and stress that's actively being managed. The hormonal response is identical either way. So where does all of this leave you, practically speaking? It leaves you with something genuinely rare: the ability to catch a problem while it's still small, quiet, and manageable, rather than waiting for it to become undeniable. Start by actually knowing your numbers rather than assuming you're fine, because nothing hurts your blood pressure, your fasting glucose, your long-term blood sugar average, your cholesterol breakdown. Move your body most days, not intensely, just consistently, because the heart responds far more to regularity than to occasional bursts of effort. Pay attention to your sleep, not just how many hours you get, but how you actually feel afterward, and take snoring or persistent exhaustion seriously enough to ask about it. Build one deliberate stress-reducing habit into your daily rhythm, whether that's a walk outside, a few minutes of quiet breathing, or simply a phone call with someone who matters to you. And perhaps most importantly, stop assuming that breathlessness, fatigue, swelling, disrupted sleep, or a fluttering chest are simply the unavoidable price of getting older. Bring them up. Name them specifically. Ask directly whether your heart has actually been evaluated, rather than simply assumed to be fine. Nearly every one of these 5 conditions, when identified early, responds remarkably well to relatively simple interventions, medication adjustments, lifestyle changes, closer monitoring. The same conditions, left to progress silently for years, become significantly harder to reverse. In cardiology, timing is very often the single largest factor separating a manageable condition from a life-altering one. Because here's the truth underneath everything we've talked about today. Your heart isn't a passive bystander quietly counting down towards some predetermined expiration date. It responds continuously and measurably to what you do, how you move, what you eat, how you sleep, how you manage stress, and how closely you pay attention to what it's trying to tell you. The people who change their outcomes aren't the ones who discover some secret nobody else knows. They're simply the ones who stopped dismissing the quiet signals and started asking better questions, early enough for those questions to actually matter. You are not too old for this to make a difference, and it is not too late to start. Every small, deliberate choice you make from here forward is, in a very real sense, a vote for more years, more mornings, more time with the people who matter most to you. Your heart has been working for you every single moment since before you can remember. This is simply your turn to start listening back.